ಸ್ಕ್ರೀನ್ ಏನು ಇಷ್ಟ ಬರ್ತದ ದೊಡ್ಡದಾಗ್ತದೆ. Yes, all of you are aware of today discussions on early clinical exposure of B complex vitamin, which is very vast. This one topic, because not as specifically we are discussing, actually it requires for the specific topic to discuss on early clinical exposure, but I don't know, it is kept in the early clinical exposure of B complex vitamins. There are 8 B complex vitamins, so whatever possible clinically. So I will not go into the chemistry part or what are the sources, already you are known sources, requirements and absorptions. So these things already, and deficiency manifestations, everything is has told. Just reviewing the clinically what is the important for the pre-exposure for the doctors or whatever first year MBBS class. So we have taken, before going to discuss already, you, all of you are, can you hear? Can you hear? Can you hear me?
Yes, sir.
I can't see all of you what you are doing, but anyhow, I will go through. See here, just before going to discuss nutrition. Nutrition deals with the nutrients. Nutrients comprises all macro and micronutrients, which are essential for our physiological metabolic functions and also good health and good growth. If it is not meet their daily requirements, which leads to the abnormalities. So which is available, there is a very well understanding between the requirement and between the nature, plant kingdom and animal kingdom. Both are one and the dependent, even both together it gives the requirements to mankind. So vegetarian, non-vegetarians, if you take, before we discuss this, nutrition is very important, and it is also, it's regulates the behavioral aspect of the everyone. So if nutrition deficiency, irritability, confusion, change in the mood, or deficiency, you are not able to do the proper concentrate your work or anything. These are the, therefore it regulates the mind physiology and secretions of dopamine, serotonin. Before going to, just some slides are there for general this 2 hours class, but strength is, I think also most of you are not attended. So anyhow, if it requires, then we'll go for our in the regular class on offline class. We'll see that. This is the first slide. Just you can see that this is general. What is requires for your this one? Not only the allopathic treatment is requires to treat. The medical elites would certainly tell you otherwise. Modern medicine is a business selling, and I am not blaming. Just it is their true fact. Business selling poison to the people to get you healthier. So one side, while contaminating the other, long-term and short-term side effect of the medicines are but one of the many example. Not only the medicines, also allopathy also requires, but not only other things it is requires, but it has side effects, and also there will be some this one exploitations by the drugs company. Most of you are aware the COVID durations of COVID, how it is exploited, not availability and selling in the higher rate of the drugs or injections. So creating this is the panic environment. These things you have seen. This is, see, there will be this regarding this, visit the Citizen Commission of Human Rights website. You will allow you to the search database containing the studies on the side effects and dangers of the psychiatric drugs also. These are all, I have done some, this is proved this. I have done some chakra healing in the past with one of my teachers, and it works very well. I did it a good 5 years ago, and symptoms have not come back since, because it is a old ancient our what is there food habits or our yogic ancient system has to follow, which regulates our balance mind and physiological functions. everyone has to follow, not only go for the what is going on allopathic treatment. So you are the medicines you have, you are able to follow your own activities. It heals the number of diseases. Therefore, this is one is a literature documentation. It's not my one. This again, the literature documentation is given on the healing of the chakra activations yourself, keeping your mind balanced, blank mind. So, and you have to stop the thoughts, whatever it is entering, let it be go. So, if you concentrate inner mind, then one day you will achieve all these things. You will become a blank. You will be very calm. You will be in the happiest mind status. So that heals and balances all your physiological conditions. This is the healing is all about the rebalancing of your body, finding harmony within yourself so that you can reach the optimal physical, emotional, spiritual health. So it is there. This is a science. If our chakra are completely balanced, we will not get the ill. This is there, which are the regulates our brain mind. Because which the immune system or all messages goes, so it send the messages to the every this one that helps. This is there. We have to. This is a very big science. So one has to do on the research on this, doing yoga and disease conditions. This is general. Therefore, what is requires now? So what is the Western's diet? What we are dependent on? What is there in the? If you drink on all the foreign drinks, whatever Coca-Cola and other things, if you drink, so nothing is there. Soda is the devil drinks I have seen because it will not nutrient, it not gives any nutrients and any health benefits. Interface with calcifications. So this is replace more nutritional nutritious drinks. So you replace by this by doing this one. So for the good cause and to immunize your body. Then what is the food? Why it is the requires food? And in, you can see that there are a number of slides. It may be boring. Just you can go through. You get ideas what is there in the food or supplements. There are the two meanings. Supplementations and the food. The Mayo Clinic states that your body needs macronutrients. So it is one of the nutrients, macronutrients. Is the principal proximates of it. It's very important component of the nutrition. So as you are aware of the metabolic role, how it energy and bodybuilding or energy synthesizing, giving the energy or even build up energy or metabolic roles. So micronutrients, which includes vitamins and minerals, that also role we have seen. So how it works in our body already we have studied for many functions. Whole food you can take are an excellent choice. They also state that an orange provides not only vitamin C. So I think if you take your orange, there will be some other components also present in the any herbs or any fruits you can take which has antioxidant properties or preventive the progressions of the disease. So our particular there will be a mechanism that influence on the specific mechanism actions. It helps act as a coenzyme, other things. There are many functions. But also there is the carotenes and calcium and free sugars for energy. A vitamin C supplement is lacking these. Free sugar for energy. A vitamin C supplement is lacking of these. If you give the supplementations, only a particular you are supplementing. Not if you take the whole, that includes number of other nutrients. So if you supplementations, it has very specifically for the particular components. So food which is compromised number of other components, potential component, mild potential components, some mild toxic component also. Body has mechanisms to detoxify and essential it takes for this to maintain the good health. The American Heart Association recommends that a healthy individual obtain adequate nutrient intake from food eaten in variety and moderations rather than from the supplements. This is the meaning. What is food and what supplementations difference Supplementation is specific, but food is component of many things. See, is it clear? Is it clear? Hello? Are you here?
Yes,
Yes,
sir.
sir.
See that what you are doing, I don't know.
Yes, sir.
You say in between something, you reply, and I will also get some uh, inspiration to teach you. Definition and classifications, see that there will be non-caloric organic nutrients, and which is needed is very small amount. There will be facilitators, help the body process the proceeds, the internal mechanism, digestion, absorption, metabolism, growth, etc. Some appears in the food as a precursor or provitamins also, which are not a inactive form is converted into active. The precursor that is called provitamins. These are there in this one. Then see, this is the another general aspect. Brain is highly susceptible to nutritional environment. It is commonly known that the brain is like a computer. So all you know, you are a computer. It receives, integrates, program, transmit all sensory motor informations. Therefore, everything is regulated by the brain. Whatever you input, it programming, whatever you program, so it transmits, it gives the information. So whatever you good things you put into the brain, it reflects, it act, it works towards good. So you want to help. It is going, the mind is working on the only helping, heal, it working on the healing of the disease. So whatever, if you put on the negative things, it goes to negative side. If you put on it, therefore this is the fantastic, very wonderful one organ, whatever it is given, everything is depends on the brain. So all messages, drugs also, it is the stimulates the only brain, whatever you are giving, the stimulation through the brain only. So whatever something, if acidity comes, immediately the message goes. If you hunger, the message goes to hunger centers. Drink, thrust centers, everything, it is works by the brain. Therefore, so we also know that manage all physiological and psychological behavior. But this we have to concentrate how brain works on psychological and physiological regulation, biochemical regulations. Therefore, this is a very important aspect. Future. So what in the such a case of COVID pandemic conditions, so how what psychological effect on this human health? Yes, so you can see that many studies have in fact demonstrated the importance of nutrition during the children's physical growth and mental development. Therefore, nutrition is a very important role for balanced diet. It is very important for control or to very good health. Very good one. See, it is known that the activity of the neurons is influenced by the different circadian, this one monthly and seasonal, so rhythms. So and is influenced by the factors as variable as meals time. There is again we have to diet system, our habit system. We have to study on this meals time also. Choice of the food and chemical constituents of foods is very important. So therefore, nutrition is a play very important role, that is in the medicines. Not surprisingly, then nutrients can be instrumental in determining the physiological and psychological affective behavior, the organism capacity to adapt to different environmental situations. Therefore, it changes according to environmental, in cold, warm, and other environmental. There will be behavioral changes. The hunger and satiety conditions, you can see that. So, regulation of food intake, recent theories, food intake regulation is a good example of behavioral response. Many theories have tried to explain how to brain controls the food intake and is responsible for hunger and satiation mechanisms. And satisfactory one we have, and a hypothesis suggests that changes in plasma amino acid pattern, all these things, and brain uptake amino acid after food ingestion provide the signals which allow the regulations of peptide. All regulation. This is metabolic progress. It's clearly health and balanced diet contribute to the stable maintenance of the brain vital function. All it is general. So then you can see what is the food, what is the medicine, then what are the vitamins. So already you know what is the food. Food is simply substance that is taking into the body to sustain life, provide energy, promote growth. This is the food. What is medicine? The science or practice of the diagnosis, treatment, prevention of disease. This is medicine. These are two important roles playing in the control of good health, preventations of disease. These are the two important aspects. And you can see that importance. Now we'll come to the our main concept on importance of vitamins in the food. Vitamins are discovered among the food, so lacking in essential nutrients are all discovered. The different diets they have identified different important components. They have named, labeled. First A, B, C, D, all the first identification, second identification, third, and fourth. Then they have found that the complexity is there. Then they have given complex F, E, and F. F afterwards, F is the sub fractions they have identified. Then they have given B complexes. Then separate vitamin C also they have identified. Lack of vitamin leads to inflammation and result of disease. So all this today will have on the B complex vitamins. So all natural diets, you can see that number of diets also you will find in the next slides. So today we'll have early clinical exposure of B complex vitamins. So already, so it is taught what is vitamin history, how history started 1980 or 70, 1817 or 80, 1800 and the era. So they have find the identified the essential factor, protective factor, accessory factor, all these things by the number of scientists. They have found out there is a prevention, there will be scurvy. They have seen that the lemon juice, by using the scurvy, they have the essential factor. Then said that cures the number of hemorrhagic disease by English physicians. All this, there is a history we have studied. Finally, they found that the life is requires, they have found that the amines are most of these contain amines. So amine compound is essential for the life process. They have given vitamin. Later I found some have contain amines, some are not contain amines. Then they dropped the letter E. So letter E. Then they have mentioned the vitamin D, vitamin 1912 by Funk, who discovered this the vitamins. So already you know this is the organic compound, very small amount requires for the biochemical functions, which generally cannot be synthesized in our body, must be supplied through the diet. Very small amount requires in the milligrams to micrograms, milligrams. So quantity requires for the normal biochemical function, which is the organic compound. So this is vitamin. So it's not synthesized. It's organic compound, vital nutrient for organism requires limited amount, small amount. There will be provitamin. So you know substance that may be converted within the body to vitamin. There are 13 vitamins are necessary for the health, maybe identified so far. So A, D, K, water soluble, fat soluble, and all others are water soluble B and B complex vitamins. A deficiency of vitamin may primary due dietary origin, or sometimes you will get the deficiency secondary because of the intestinal problems, GIT problems. So any defect in the GIT, then transportations, then uptake problems. So any inborn error disease and uptake defect. This is transportation defect. And storage, metabolic conversions, there will be any enzyme conversions and the one into other form, there will be problem, and these also responsible for the deficiency. So next you can see the all number of whatever it is, thousands of hundreds and of Nobel prizes. So there in the elucidation of structure, physiological function, absorption, deficiency of number of manifestations. So this is a number for vitamin discovery or any science discovery has Nobel Prize. In the 1910 to 2000, some small list is given here. Then you can classify, there will be water soluble and fat soluble, whether it is used for energy or RBC synthesis, hemopietesis, and other functions. These are all 13 vitamins is given list is so you given their names also, whatever vitamin and name retinol, so and similarly B1 is thiamine, B2 is riboflavin, so on. So niacin, B3, all these things you know already we have studied. Vitamin C is ascorbic acid, is the chemical component name and abbreviated with this single letters, it's a name also. So you can see this is the number of physiological functions, metabolic functions. The vitamins are takes role in the either brain metabolism, brain tissue metabolisms, or bone metabolism, the calcium, all these things, and phosphate, their minerals along with this vitamin requires for their absorption, their metabolic functions. The muscles and metabolic functions, digestive functions, or intestinal metabolic process. So all these are active form of these B complex enzymes. Or active form is coenzymic form of enzymes. The coenzymic form, you can take example, thiamine is the vitamin, active form of the vitamin. Thiamine is thiamine pyrophosphate. So all we have studied already. So I will not go much more time on this. What is the active form of this FAD, riboflavin, NAD, niacin, pyridoxal phosphate, PLP, folic acid tetrahydrofolate, the coenzyme A, we have pantothenic acids. So biocytin, biotin, and cobalamin. So these have vitamin B12. These are the active forms takes role in the metabolic process, act as a coenzymes in any process, enzyme, substrate binds, catalyzed by in the presence of coenzyme and cofactor, the product will be formed. So there will be definitions, classification, water soluble vitamin, so all found in vegetables, fruit, grains, meat. So absorbed directly into bloodstream, not stored in our body. Toxicity is very rare because of the soluble and exceed. So alcohol can increase the elimination. Smoking cause and decrease the absorption. Therefore, alcoholic and all these are sometimes you will find the deficiency of this vitamin deficiency. Elimination is more. See, next is these are 8 vitamins. How to remember? They have given one quotation: tender romance never fails with 6 to 12 beautiful pearls. So all these, the thiamine, tender, riboflavin, romance, niacin, never. So pains, folate, 6 and 12, beautiful biotin and pantothenic acid. Very difficult to how to remember. There is then tender romance never fails with 6 to 12 beautiful pearls. See this one. So 8 in the metabolic and energy release from the carbohydrate lipid amino acid metabolisms already. So you have studied, not taught online, offline, and this some of the aspect is covered. So mode of actions, how it coenzyme, a part of coenzyme that necessary for proper activity of the enzyme okay, chemistry. So already I told you how the active enzyme, the product is formed. Now you can see the next slide. See, eat more. So I am not against non-vegetarian, the vegetarian, but it is the most one. It is available in the nature. So nature we have to protect all. All animals have rights to lead their own kingdom. So this therefore available in the plant. So eat more fruits or vegetable than this one, because digestion system is very more easy for digestion of vegetable things than the non-vegetables. It takes more time to digest fibers, all these things it takes. So digestive enzymes are not appropriately. This is the, so what is the better you have to give the, because once it's available in nature, so plants, the preference, then some other conditions also you can use sometimes the non-vegetarian also. See that this is the how beautiful this is the, then they all this slide shows that nature having the all variety of fruits, vegetables, grains and nuts is not given here. All fruits is given. All it contain the all essential nutrients, vitamins. So this is C. We have to prepare for this. Take regularly this one. Then some only few examples, not specifically I have gone. If a deficiency of these nutrients, so you will get all this type of abnormalities, velocities, chillosis, and feligra. So you will get the feligra like this one example, like a number of other conditions also you will get in the dermatitis. So this is one type of dermatitis you will get. Present tongue you will get in the riboflavin deficiency. See, in thiamine deficiency, there will be two types of dry and wet, very you will get. There is one is a neurological and cardiovascular, the cardiac function is abnormal, then you will get the swelling edema. So when you press this one area, you will get the thumbprint of this one, this edema. So this is all stomatitis is the other cause you will find these one, small 1 or 2 vitamins I have shown here. So what are vitamins, nutrients in our body does not make its own. Thus, we must obtain from the food. So we eat our via vitamin or supplements. Either it is present in our food or it is not there in our diet, you can supplement synthetic one. They are essential providing the good health and are necessary for many life functions. Next slide, you can see the supplementation. What are they? Synthetic. Natural substance which can be purchased as a pills, tablets, capsule. All these things you can see that liquid form, all this available. Then questions it comes, should I get my vitamin from food or supplements? A diet is the high in fiber and low in fat is the best way to meet daily nutritional need. If you closely follow the food pyramid, then you should meet the RDA recommended dietary allowances for vitamins and nutrients. Supplements are the best when accompanied by the well-balanced diet. Supplement also sometimes requires along with the our regular diet. Supplement should not be replace a healthy diet. The supplement you are taking any Horlicks or anything, you can take any nutrient multivitamins. It not means that you should stop your diet. You take along with the diet, you can take supplementations. Then you can take the food provides calories and energy that are required for daily activities. Vitamin supplement do not provide energy or calorie. If you take this is calories, therefore principal complement food is essential. So do I need multivitamin supplement? It does not hurt to get a little to take a multivitamin daily to ensure proper nutrition. Most of college students are not eating a well balanced diet and could use their added the added nutrition of multivitamins. And choosing a supplement, select one that meets 100 to 300% of RDA. So such a supplements you have to select and take. What do multivitamins contain? A multivitamin should contain all these vitamins, all these things, and even minerals. And important are zinc, magnesium, copper, calcium. Already we have studied how it acts zinc in immune booster, or healing of the wounds or inflammations, all the things. Magnesium or phosphorylations, reactions, copper, all calcium in the bone, all these things we have studied. If it is covered, what does RDA means? This is recommended by the university. This is allowances. These are suggested level of essential nutrient considered adequate to meet nutritional need of healthy individual every day. So RDA is required. So most of vitamins you can get in the milligrams and micrograms. So most of vitamins is less than 2 milligrams is required. Only niacin is more than 10, so 15 milligrams. Then you can have others on the micrograms and folic acid and B12 all micrograms. Vitamin C around 70 to 90 milligrams requires. What are the antioxidants? You can substance which fight the free radicals which synthesize, produce in our body and metabolic process that damages the polyunsaturated pupa of the cell membrane, which leads to all pathies, myopathy, cardiopathy, retinopathy, all these things. So in order to prevent this one, we have to take the vitamins. Some vitamins act as antioxidant, so natural antioxidant. Some enzymes are there, enzyme antioxidants. So the free radicals are neutralized. So negative charge molecules is neutralized by the so positively charged components, natural components. Free radicals are compound within our bodies that leads to chronic disease or involved in these cell tissue damages. So example which can be prevented by antioxidant, vitamin C, beta carotenes, lipoic acids, all these things are there. So this is antioxidant. What is the difference between fats and already we have studied. So only if it is stored, it is not stored. It is regularly required. It is not every day requirement. It's stored, which can meet the some 15 days, month of requirements because it's stored. So body fat soluble. So it is toxic. Excess is toxic. This is not toxic because it excretes. So what the factors should I consider before taking the vitamin supplement? Do you eat food high in vitamin and minerals? Are you eating? Are you dieting? Do you follow the food guide pyramid? Do you smoke? All depends on this. Drink regularly. Are you pregnant? Pregnant? Are you over 50 years old? Are you taking prescriptions of drugs? All everything it depends on all the so many factors. Okay. General knowledge. Can I take too many vitamins? For the most of part of vitamin supplements are safe to take. Follow the recommendation dosage on the label of the bottle. Fat cell vitamin are more likely to be toxic to your health if taken in excess. Long term, if you take, so that stored in toxicity, so vitamin A, vitamin D, all that leads to toxicity. Stored in the body where water soluble is excreted. Advised to take vitamins with snacks, meals to avoid the stomach irritation. All these things are there. See, stress nutrition in your body. Stress can cause your body to excrete nutrients rather than using them to perform the vital function. Therefore, this factor is responsible for all stress-induced syndrome or disorders. Mainly, the stress is the very nowadays it is the very play what more role. So one how to prevent, how to come out from the stress, it is very important. Therefore, we will go for our ancient system of yogic system, some meditations, and keep your mind, reduce your stress from the work or whatever family responsibility or anything. The stress is the cause for diabetes mainly. So how it causes and more free radical generates, then it damages all abnormalities are because of this stress. Supplementation adds surprise stress, increase all serotonin level in the brain. Lots of stress-related symptoms like depression, irritability, frustration. And mineral magnesium can help regulate the serotonin level. Antioxidant supplemented can also break up the free radicals that cause harm to your body. These things, these are the vitamins. We'll see one by one. So already we have studied. See, this is the vitamin, water soluble vitamin, thiamine. All Greek terminology, all compound, sulfur compound is present in the amine, their name is thiamine. So this mainly regulates very number of metabolic functions in forward metabolism or in HMP pathway, citric acid cycle pathway. So the active form of this is required, TPP is required for transcriptase reactions and even pyruvate converted to acetyl-CoA reactions, thiamine pyrophosphate. Neurological function it requires thiamine. This is produced energy and from carbohydrate, proper nerve functions, and stabilizing the peptide, promoting the growth, good muscle tone, and ATP production. So this is the vitamin. They play a very important role. So this vitamin deficiency is called very very. I can't. That meaning. So very very, because you cannot do the normal functions. See, deficiency, loss of peptide. These are the all insomnia, weakness, loss of weight, depression. This is the all gastrointestinal problem, heart problems you will get. See, here is the one of the important aspects in the cardiovascular manifestation, thiamine deficiency. See here, cardiovascular manifestation in thiamine deficiency are, see, palpitations, increased heart rate, tachycardia, enlargement heart, cardiomegaly, hypertrophy, palpitations, cardiac failure, edema. So this is the cardiovascular manifestations in thiamine deficiency. You will get the dry very very, wet very very similarly. In the wet very very, you will get all these abnormalities. Dry very very, will get neurological, cardiovascular manifestation, diabetes, cardiovascular manifestation, thiamine, edema is, see this one, edema, swelling, the leg, ankles, and foot, you will get the edema. See, cardiac failure in thiamine deficiency, failure of carbohydrate metabolism rate decrease. What happens in the mechanism already taught you, this resulting decrease of production of ATP. So demand for oxygen supply for peripheral tissue for synthesis of ATP through biological operations of electron transport chain. So it leads to palpitation, increase the heart rate, tachycardia, to fulfill increase the oxygen demand by the peripheral tissue. There is this one is leads to the enlargement of heart. So all these things. Then you will get the vein effort, hard for the oxygen supply to peripheral tissue due to the microcytic hypochromic anemia, as availability of succinate alcohol is decrease, therefore decrease in the heme synthesis. All this one another, it is interrelated with how circulation and heme synthesis, all this thing. This leads to cardiac failure. So this is another cardiac failure in thiamine deficiency. You will get the cyanosis of the nail. Then you will get the neurological manifestations. This is called dry very very, mental confusions, motor sensory neuropathy, that is called Wernicke encephalopathy, peripheral neuritis. Neurological manifestations are due to, there is the mechanisms of what happens, decrease of levity acetyl CoA, NADPH, resulting in decrease of fatty acid synthesis, decreased tryptophan paralyzed activity, all the D for PZ level they have to go through. This is what mechanism involved in them. Decreased transcriptase activities, so there will be no synthesis of NADPH. All these things you will get in the neurological manifestations. You can say that gastrointestinal manifestation, thiamine deficiency impaired cellular functions of the gastrointestinal tract to impair the digestions or this loss of peptide. So very very, you can see here, very very, I cannot know meaning, cardiovascular, neurological manifestation, gastrointestinal symptoms, type of very very, you will see all dry very, infantile very very, Wernicke Korsakoff syndromes, cerebral very very. Those who can see in the, those who are taking alcoholic, regular alcoholic, polyneuritis in the birds also you can see. That very very, you can see thiamine deficiency, all increased palpitations, heart become weak, breathlessness, edema, all this thing, neurological manifestation. These are the two types of wet and dry very very. So you get in the deficiency. See, the feature shows that wet very very, and here cardiovascular, abdominal swelling, so enlargement, heart enlargement. This you can see in the deficiency also. Vitamin also play a role. See the dry, then you see these are the dry very very, unable to walk, stroke, inability to speak, great weakness, confusions, emaciations, loss of tendon reflexes, burning and tingling, numbness of the feet. This usually we'll find it is not specific for only one. In numbing, tingling, all other vitamin also deficiency leads to sometimes burning and tingling, or even circulation defect, any L4, L5, any obstruction flow of blood, that also will get the burning, tingling, or numbness. Get or any neurological or neuropathy also will get the numbness of the feet. So infant very all these see that the baby is restless, sleepless, anorexia, vomiting, convulsion. It is not specific for this one. This is one you have to or doctor pediatrician to rule out. This also you have to rule out, take into consideration whether it is there any vitamin deficiency. So other cause are there for the baby, restlessness, sleeplessness, all other conditions. This is the one you have to take into consideration. So vitamin also. See infantile see the so occurs in the infant usually age between 3 to 4 weeks, who are breastfed by the thiamine deficiency mother, heart failure which may cause the sudden apnea, absent of deep tendon reflex are characterized. So these things you can see. Even alcoholic, there will be deficiency or X-corroscon syndrome. Those who are drinks, they will get the deficiency. So X-corroscon or chronic alcohol, thiamine deficiency, brain tissue, ischemia, cell death, vernix, then corroscope. Acute confusion state of all these things, ataxia, all this, you will get the conditions of psychosis. There is a sign and symptoms for early diagnosis. Usually never specializations, all in the physicians, all they will find this pathological changes, fixed pupil, broad-based gait, cerebral sign, all these conditions, cognitive changes, the behavior, find. So number of slides are there, leave it. Vernix, encephalopathy, I can see all these conditions. Biochemical changes in the thiamine deficiency. All you know biochemical, there requires PAR, acetyl-CoA, pyrite to acetyl-CoA changes, TPP and other coenzyme also requires. PLP, NAD and other things are required, so you have studied. Pyrite does not cross the blood-brain barrier and enters the brain, the toxicity increases. The alteration occurs in the blood-brain barrier, permits the pyrite to enter the brain directly. Pyrite accumulates in the brain. This is responsible for polyneuritis. Then lactic acidosis, increase plasma pyruvate concentration, increase the plasma lactate concentration. So these are decrease in the alpha ketoglutarate activities in TCA cycle, increase plasma alpha ketoglutarate concentration. And you have transcriptase activity decrease, polyneuritis, transcriptase activity decrease, earliest manifestations. Polyneuritis, deficiency of thiamine, all these then pregnancy, chronic alcoholism, old age, diabetes, supplementation. So who at the risk? Homeless, malnourished, alcoholic, people with malabsorption conditions are risk of vitamins. Then you come to the riboflavin. So energy productions, all metabolic process, coenzyme is requires riboflavin. So formation of antibodies, even red blood cells, cell respiration, maintenance of the good vision, skin, nail and hair, all these things, vitamin requires. Deficiency usually the dermatitis and vagina tongue, all this itching and burning eye, cracks and sore mouth in the lips is common. Corner of the mouth and lips and the cracks. Bloodshot eye, sometimes it get appearance of red eye, dermatitis, oily skin, digestive disturbance in these things. All usually the more common we find in the oral angular stomatitis, chelosis, glossitis of the all oral cavity of mouth. So you will find these things. Facial also you will get the dermatitis of the nasolabial region, the riboflavin deficiency. Ocular, you will get the vascularizations of the cornea. This is the vitamin B2 deficiency you will get. So all this corner of the mouth, cracks and red lips, inflammations of lining of the mouth and tongue. So this you will get. Now, mouth ulcerations, rand, scaling skin, seborrheic dermatitis, eye become bloodshot, itchy, sensitive to bright light. So all vitamin levels, see that so many things. So you will get the any other infection also you will get the eye become bloodshot or even it will become inflamed. So this is also one considerations of vitamin deficiency also the cause for this. So all corneal vascularization, dermatitis, glossitis, chelosis, all these things are riboflavin deficiency. So you will get see all magenta tongue, cracks, corners. Who are risk? People with cataract, people with sickle cell anemia, alcoholic also responsible for this. Niacin, very important, and the vitamin, energy productions and metabolic role, NAD, NADPH, a number of metabolic processes which usually act as a coenzyme, synthesis, breakdown, pathways, protein, lipid, even carbon breakdown synthesis, NADPH is very important role as a coenzyme. Maintenance of nervous system. Can you see these things? Studied? All these things taught in your theory? Two types. Hello? Are you hearing? Anybody? Ranjan?
Yes, sir.
See that, just you see at least too many slides are there. It is a difficult, that's why I told you in particular if you take in the early clinical thiamine, we can go deep for thiamine, every mechanism action, how it is the deficiency of it is how to cover all 8 vitamins difficult. Even I have therapeutic uses I have not covered here. These are nicotinamide, niacin, nicotinamide, niacinamide. These are the two types. Does not regulate cholesterol. Niacin is nicotinic acid, biotoxics in large dose. All these things you can see that. Warning does only 550 to 500 milligrams nicotinic acid can cause the dilatations of the blood vessels, potential painful tingling, diarrhea, nausea, vomiting, long-term liver damages. Nicotinamide is the almost always safe to take, although few cases liver damage have been reported in the doses over 1000 milligrams per day. Nobody will take that 1000 milligrams. Especially if you take. This is see that high blood pressure. Niacin has been used to vasodilator to dilate the blood vessels and correct the blood pressure changes. They will use high blood pressures. So these things, enlargement of heart, so high blood pressures. Heart-related disorder also, niacin has been found to provide a relief in the angina pectoris. So this vitamin play important role. It has also been found useful in the case of cerebral thrombosis caused by the blockage of the blood vessels of the brain due to clot of the thrombus. This is niacin vitamin. So even it is a vitamin it requires for even post-COVID complications. You have seen that with clot appearance and thrombosis of the brain, thrombosis in the other so veins. Some cases are reported. So there will be or thrombolytic drug recosprin or then continued for the treatment and after post-COVID also 1 or 2 months which has taken that prevents dilatation. Thrombus will not be happens. This is there along with vitamins. High blood cholesterol, niacin is proved have this work has done which reduces the high blood cholesterol. So it is one, somewhat it helps one. Not only this is the cause, but the other cause also there are the high cholesterol can be responsible for other factors, but even niacin is also, it helps for the reductions. Even drugs are there in the statins are given for the so cholesterol reductions of cholesterols. The niacin, it is called 3D usually. Dermatitis, diarrhea, dementia can be treated. So advanced niacin therapeutic does. B vitamin can cure all ailments. See migraines, niacin is useful for treating migraines. Pellagra, the disease caused by B3 deficiency and gastrointestinal disturbance. All these things we will get, therefore it is called 3D. So dermatitis, dementia and diarrhea. So fourth is a death. It is, if it not treated, it's very rarely we will find nowadays. So deficiency not there. Only we'll find the nutritional deficiency. So where we'll find in Somalia. So where very poor, underdeveloped countries. So very number of cases so we'll find in the nutritional deficiency, kwashiorkor or marasmus. So due to all other vitamin deficiency, we'll find in children's death. So nutrition is very important. So vitamin is play a very important role in good health. C. Pellagra, but a necklace-like skin dermatitis, erythema occurs, feet, ankle, face, pigmentation around the neck known as the castle necklace. This specifically, and even dermatitis you will get any exposure to sunlight. So this is one type of it. This, dermatologist can identify different deficiency or combine. So vitamin deficiency may be there, or fungal infections are there. So any other things can untreated fungal psoriasis, different aspects are there. Specifically, this is also niacin also leads to deficiency, skin deformities. See, this is on picture. See the feet, ankle region, any disappearance or wounds or other things we will find here. See here, facial, lips, cheeks, all these are infected dermatitis. See here, peeling of skin. See here, dermatitis features, dermatitis pellagra, nutritional deficiency along with vitamin deficiency, toxicity, painful flush, hives, or rash. You get excessive sweating, blurred vision, or glucose tolerance. Who are risk? Most of the people get plenty of B3 deficiency because it is added to fight loss. This is another important vitamin, pyridoxine, production of red blood cell, and conversions of tryptophan to niacin, immunity, nervous system, and any carboxylation reactions, sulfuration reactions, transamination reactions. So it requires coenzyme and PLPs, number of heme synthesis. So deficiency will get the weakness, deafness, or neuropathy, personality changes, the velocity is all like that. So nerve damages, anemia, peripheral neuropathy, nausea, loss of appetite, nauseous. So see many things are there. It's combined. Sometimes you'll get in very vitamins also you'll get mental confusions. VLP also you will get. So all B complex deficiencies you find the number of common symptoms. Specifically, you can hypochromic microcytic anemia you'll find in there because of PLP requires an heme biosynthesis. So in ALA synthase activities, PLP is dependent. If it is not there, then the heme will not be there. Therefore, you will get the change in the heme synthesis, hypochromic microcytic anemia kind. So, and also ferroxyl mostly seen in the woman taking oral contraceptive pills, alcoholism, or anti-tuberculosis drugs, ATT, especially INH, isoniazid, so anti-tuberculosis drugs. There will be find the deficiency. So isoniazid inhibits. So this will leads to deficiency. So therefore, requirements of B complex is requires ATT. You can see this depression, all nausea and sore of the mouth is common. It's common symptoms. Most of our vitamins deficiency. All these symptoms, high doses of B6 may be recommended to treat PMS, tonal syndrome, sleep disturbs. Who are very rare, alcoholic, patients with kidney failure, or oral contraceptives are risk for this. This another vitamin, cobalamin, proper nerve functions, production of red blood cells, DNA reproduction, energy productions. Hypersensitive of skin, applications of vitamin B12 C, they act as an antidote for cyanide poisoning. Cyanoclate containing hydroxycobalamin, a form of vitamin B12, which is used for antidote to the cyanide poisoning. This is for clinical use. See, this is used for hydroxycobalamin works helping of the cell and body converts cyanide to a form that can be removed from the body through the urinations. This is one. Applications of vitamin B12 regulates the overproductions of allergy antibody IgG in allergic individuals. See this one. So it is used in an allergic reaction. Applications of vitamin B12 responsible for reducing depressions. See, vitamin B12 works together with the compound produce the serotonin, reduce the incidence of depression. This is very helpful to the elderly, so all the older people whose production serotonin typically low, all Alzheimer's or Parkinson conditions. This is a treatment is very important. Treatment for anemia diseases. Get anemia all along with in folic acids, very important in the pregnancy. Use helps for healthy regulation of homocysteine control. Homocysteine risk factor for heart disease is one of the marker used. Adverse effect of the cardiovascular system, brain functions, neurotransmitter functions, and mood balance. Helps protect against the cancer, including breast and colon or lungs. Prostate cancer is one of the factor helpful, not a specific. It helps for protection of cancer. Application of vitamin for treatment of pernicious anemia. B12 it leads to pernicious anemia. The skin, hair, nail, all this you can see. Application of vitamin responsible for reducing the brain shrinkage, all dramatically lower homocysteine, a risk factor of brain shrinkage. Symptoms vitamin B12 includes all fertility, fatigue, depression, irritability, mood change, old age, Alzheimer's, dementia, autoimmune disease, cardiovascular disease, cancers. This is therefore play a very important role. Megaloblastic anemia, neuropathy, all these things are. You can see that. Nitrogen deficiency, decreased production of intrinsic factor, extrinsic factor, or their absorption, pancreatic insufficiency, all these conditions you get. Crohn's disease, surgical resections. So vitamin D, vitamin B12 is important. So all this is intrinsic factor defect. Megaloblastic anemia will allow more symptoms of vitamin B deficiency in megaloblastic anemia and pernicious anemia. However, subclinical cobalamin deficiency is an increasingly recognized condition, especially those with predisposing conditions such as ileal disease and gastric surgery. Advanced cases of anemia may be severe. Hemocrite has a low 10 to 15%, maybe accompanies leukopenia, thrombocytopenia. So megaloblastic state produces change in mucosal cell. All these things you can see in megaloblastic anemia. Peripheral blood smear, megaloblastic anemia. So histopathological slides. So see neurological changes in the deficiency. Change of vitamin B12, cerebral function may alter, as well as the occasional dementia, neuropsychiatric changes, mood change. There will be relations between the very important relation between the cobalamin and folic acids. So in the synthesis of DNA, folic acid reduction, DNA synthesis, all it leads to the megaloblastic anemia, the mechanism, how the velocities and demyelinations, neurological changes. So this is the cobalamin combined together, there will be deficiency. And microcytic anemia, this is differential diagnosis. The vitamin B12 should be differential from the folic acid deficiency. Both are together, they will be treated. So differential also can. Other common cause megaloblastic anemia in which red blood cell folate is low, while vitamin B12 level are normal, megaloblastic. Pernicious anemia, B12 is deficiency. Vitamin B12 deficiency, myelodysplasia, more common cause, macrocytic anemia with a abnormal morphology. Pernicious is a chronic illness caused by impaired absorption of vitamin B12. This pernicious anemia. Then you will get clinical manifest pernicious anemia, general finding, weight loss, anemia or tolerated pernicious anemia may be patient is ambulatory with hemocrite levels and mild teens. These things are their neurological symptoms, etc. You can see that gastrointestinal, urinary system, retention. Pernicious anemia B12 injection often taken regularly. HIV, chronic fatigue syndromes. See, and there it is very most common as like thiamine. This is an important one in the water soluble vitamin. So most common question is asked in the thiamine and vitamin C. It is a major questions, long questions they will ask in this. Rest of things are other short notes and other things asked, short essay. But here is the major vitamin C also asked, or toxic and virus bacteria also, malignant tumor cells, antioxidant, water soluble vitamin. What are C's functions in the body? Protect your body from free radicals, helps from the connective tissue, holds your bone, muscles, tissue together, collagen formations. It's in the healing wound, important role. And also in the absorption of iron, iron vitamin C helps in the iron absorptions, mucosal block theory, you know this one. Helps to keep the gum and healthy, fight infections. It is hence it is called as a cold to cancer. Sometimes it refers to vitamin C's. It helps cold to cancers, means cold to whatever in the infection. So it's a booster of immune boosters. The prevention of heart disease, help prevent some cancers. See, let us see this one, harmful effect of larger dose. If you take 1000 gastrointestinal discomfort, rebound scurvy, avoid chewable tablet may cause the damage to the teeth. If you take more, you cannot eat, the irritations you will get in the teeth. So if you take more doses of lemon or mango or whatever vitamin C content things in the whatever fruits available, so it makes you many fruits you will get the vitamin C containing fruits. It causes teeth. So in vitamin C, the water soluble excess amount body does not need to be excreted. Some problems, weight loss, fatigue and joints, healing wounds, fractured bone, kidney stone, This department of Harvard School has studied done and the 45,000 people had no previous case of kidney stones. Some subject took up for the 30 times of the RDA values, showed no increase risk of kidney stones also they have studied. So what it is? See, vitamin C deficiency, proliferation hemorrhages, bone cartilage problem, normocyte, hypochromic macrocytes. These are the oxidize. What are the functions? Vitamin C in the body, number of functions: bone formation, collagen formations, conversion of cholesterol to bile, bias in the corticosteroids, tyrosine metabolism, hemoglobin metabolism, iron metabolism, number of antioxidant role, carnitine biosynthesis, methylation of DNA in the stones, prevention action of chronic diseases, prevention action in the chronic disease, anti-diabetic, prevention of quick aging, cataract formation, immune response, important, immunological function, immune response. Therefore, this is very important role of vitamin C. So name ascorbic acid, coenzymes, no specific form. All these things are there. Category wise, there were requirements. Cause of scurvy deficiency vitamin C. I told you number of scurvy. Oral contraceptive pill, infection disease, alcohol dependent, mentally ill patients. Fragile blood vessel, hemorrhages, petechia, pinpoint subcutaneous hemorrhage, bleeding, peristyle due to increased capillary fragiles, delayed wound healing, sore gum, swollen, spongy, bleeding, painful gum, poor dentin formations, ostid formation, defective, impaired bone formations, impaired erythrophysis, decreased immunocompetency, sluggish hormone functions, and adrenal cortex. See, this is number of manifestations you can see: edema, psychological disturbance, anemia. Clinical manifestation of scurvy is common. See, this is what is scurvy. Oral cavity in this scurvy, sore gum, swollen, spongy, bleeding, painful. Pulp is separated from the dentin. The finally teeth are lost. Wound healing may be delayed. So this is bleeding gum, poor gum. One you will get petechia, you can find subcutaneous hemorrhages. Scurvy you will find. So all microcytic hypochromic anemia, and here hair, corkscrew hair, dry and piled hair, small blooding near the hair follicles, Burger's sign, epiphysis of a small sharply marginated sclerotic rim with the central portion of more radiological. So these are radiological features. Hemorrhages tendency in scurvy, deficient formation of collagen, capillary or fragile, tendency to bleed. So here usually commonly we will find in vitamin C, tourniquet test determines the hemorrhages tendency in the scurvy. Tourniquet test, fragile test, capillary resistance test. A sphygmomanometer cuff is placed around the forearm and inflated so that compresses the venous blood flow. This pressure is kept for 5 minutes. Appearance of the several petechia hemorrhages 20 or more. 6.25 centimeter may be seen in the forearm of the skin indicate vitamin C deficiency. This is you will get the bleeding into tourniquets, all this internal tourniquet, petechiae, findings. Central hemorrhage of scurvy, subconjunctival bleeding, nosal bleeding, all these things we get. Splinter hemorrhages in the nail. Barlow disease, infantile scurvy, manifested in infants between 6 to 12 months of age. Next, we look at clinical infantile scurvy, Barlow disease. These are edema in the lower extremities. Extreme tender swelling may be felt at the end of the long bone or acute painful due to hemorrhage under the peristeme. Stemum may be sink slightly inward. Bachelor redover scurvy, elderly bachelor redover who maybe prepare their own food are particularly prone to develop vitamin C deficiency. So deposition of hemosiderin in the skin, severe scurvy. Therapeutic use of vitamin C can decrease the cold episodes, severity of the symptoms, enhance synthesis of immunoglobulin, increase the phagocytic functions, may act reacting with free radicals, has beneficial effect treatment to tuberculosis, plasma level kept near saturation, clinical dose of 500 milligrams. Recommended treatment of ulcer, trauma, injury, and burns. Except scurvy subcaravate condition, therapeutic use of vitamin is not specific. So, role of ascorbic enhancement of immunity. See, this is used in the COVID patient, vitamin C, limb C, or one. See how role enhancement, how it helps for the immune system, neutrophil uptake. Neutralization by all this mechanism involved in the macrophageal and dendritic cells, how it T and P lymphocyte stimulations and virus neutralized. Replication is blocked. Infected cell lysis, virus here. This is a C, vitamin C, the role, macrophages, mechanisms. The possible effect of ascorbic acid in management of COVID-19. So this is given the possible beneficial effect of vitamin C management in COVID-19. Anti-inflammatory effect, antioxidant effect, immune response, indirect antiviral effect, critically ill patients, ventilation, shortness, ICU stay, increase. So the requirements, this condition it is used beneficially. It is water soluble, no toxic effect. More than 2000 milligram vitamin C prevent per day prevents the infection, but long-term use of a mega dose can cause iron overload. Deoxyrized ascorbic acid is toxic. Oxidized ascorbic acid is toxic. Potential but rare adverse effect of mega dose. Number of function advantages with vitamin C. It's controversy. Mega dose of ascorbic acid is controversy. Number of it is controversial and going on. Linders is treated. The first advantage consumption of mega dose ascorbic acid 18 grams per day, 300 times a daily requirement, prevent the cure common cold. Infection. Keep vitamin C is the gunny bag and eat grams. It is now clear that mega dose vitamin C does not prevent the common cold, but the duration and severity of common cold is reduced. It believed that ascorbic acid promotes the leukocyte functions. Megadose 1 to 5 grams vitamin C still continued common cold, wound healing, and trauma, and provides the some health benefits. Quick aging process is delayed. There are controversial report megadose vitamins leading the urinary calcium oxalate is going on. This is controversial aspect. Clinical vitamin C, already I told you. So weak dentin, bleeding gum, wound healing delayed, so hemorrhages. Next is the last one is some can take it folic acid, folasin deficiency. Folic acid is an essential vitamin needed for chickens of all ages. It is all named as a folate, vitamin I, folasin. Folic acid deficiency means lack of folic acid. All susceptible, all these things you can get folic acid deficiency cause the decreased egg productions, reduce growth, reduce hatching rate, poor feather, fading feather color, anemia, weakness, stunted growth, chicks dies after dipping cell. All symptoms you will get. Birth defect. It is very important to know that everyone, any physicians or anyone, gynecologist to birth defect. So neurological abnormalities. Folic acid during the pregnancy may lead to homocystinemia. Neural tube defect is very common. In the spinal brain will get a defect. The two defects, not proper formation of tube or this is the folic acid prevents the birth defect, malformation of spinal bipeda. Supplementation of folic acid early pregnancy must be prevented and neural tube defect in the child in 1 month, 21 to 28 days. So folic acid treatment, therefore pregnancy regularly they will give the folic acid to prevent this neural tube defect, to prevent neural tube defect. Deficiency manifests reduce the DNA synthesis, folate deficiency, all this DNA synthesis, all base pairs, activation, conversions in the one and the, it's very important. So the macrocytic anemia, the most characteristic feature of folate deficiency, erythropoiesis, DNA synthesis delayed, but protein synthesis continue. Thus, hemoglobin accumulates in the RBC precursors. Macrocytic, see that these are the features, shows reticulocytosis. Folic acid deficiency may cause the increased homocysteine level in the blood. This is the risk for heart disease. This completes discussion of early exposure of clinical exposure to B complex. It's very vast, so we have to take only one vitamin and go to details of clinical defect, clinical requirements, therapeutic uses, deficiency aspects, or we can discuss anyhow. So somewhat we have covered. So any other your problems, so we'll discuss in next small group discussions. So we'll have more interactions and more discussion on individual vitamins or deficiencies, requirements, and therapeutic uses, and interrelations with the other diseases. Thank you.